Good morning and welcome to Bloodborne Pathogens and Syringe Safety with a focus on PPE. Today we will discuss what bloodborne pathogens and how they are transmitted. We'll also discuss how to prevent or decrease the rate of transmission using medication to treat or cure certain pathogens. We'll discuss vaccines and the role they play in preventing certain diseases, the general precautions, including PPE and cleaning practices, and the importance of syringe safety and the role that it plays in the transmission of bloodborne pathogens. So, what are bloodborne pathogens? I'm pretty sure that you've heard this before. You're pretty familiar with it. There are three most common bloodborne pathogens here in the United States, but basically they are microorganisms such as viruses or bacteria that are carried in blood and can cause disease in people. The three common ones in the United States are HIV/AIDS, hepatitis B virus, and hepatitis C virus. I'm sure that you are familiar with these, as HIV is the acquired immune. HIV is human immunodeficiency virus. AIDS is the acquired immunodeficiency syndrome. These are, again, the three most common types in the United States that we will focus on today. But these are not the only bloodborne pathogens. There are more than 20 additional pathogens that are known to cause disease or infections in humans. Some of these include Ebola, malaria, and syphilis, just to name a few. So as we know, HIV/AIDS is transmitted through contact with infected blood, semen, or vaginal fluids. At this time, there is no cure for HIV. However, there is new medications that are here to treat it and cause viral suppression. It is mostly spread through blood products by having unprotected sex with an infected person. This is vaginal, oral, or anal sex. It is also transmitted, although most days now today that it is very minimal risk of mother to baby during labor or nursing. And some of the symptoms include fever-like, flu-like symptoms such as fever, sore throat, fatigue. Most of the time when people first are infected, they will have like these very minimum low-grade temperature to the point where they don't even notice it. They just kind of brush it off as allergies or cold and just continue to go on about their day. So with hepatitis B, it is a liver infection that is spread by contact with infected body fluids via sexual contact or needle sticks, as well as mom to baby. It can live outside the body for quite a while. We'll talk about that a little bit later on in the presentation. And symptoms can include weight loss, abdominal discomfort, nausea, vomiting, rash, and progression to jaundice. It can be pretty severe. Most people that become infected with hepatitis B do clear the virus on their own, but there are some that do not. And for those that do not clear the virus, it becomes a chronic disease. And it can lead to cancer of the liver or cirrhosis. So for hepatitis C, which is also affects the liver, it is spread via contact with contaminated blood. Most people have no symptoms. And when those do develop symptoms, that includes fatigue, nausea, loss of appetite, yellowing of the skin, which is jaundice, eyes, and it is very easily spread. So how are bloodborne pathogens transmitted? So most of the time it's percutaneous. As we know, the skin is the largest organ on the body and it has a high chance of being exposing to the blood, direct contamination with infected blood through like punctures, via needle sticks, what could be on the fingers, broken glass, stepping on glass that's been infected with that, or other sharps, cuts, scratches, or wounds. The mucous membranes, as right now we are very hypervigilant with touching our face and things like that, but having contaminated hands and then touching your eyes, nose, or mouth can expose your infections to your mucous membranes. And then, of course, most commonly sexual contact, coming in contact with vaginal or semen fluids, which does contain blood. So those are the most common ways. Right now, we are also seeing an uptick of hepatitis C and HIV infections, and there is in IV drug users. So right now, avoid eating or drinking, smoking if if your hands are contaminated, if you've come in contact with a person with an unknown HIV status, if you are seeing patients, make sure that you're washing your hands and having your gloves on if you don't know if you have open sores. Our phones, which we are seem to be glued to these days, they are also a source of contamination. So you should also be sanitizing your phone frequently, especially if you're seeing patients and touching your phone in between patients. So the risk varies for people. It depends on the volume and concentration of the virus in blood. So the amount of hepatitis B in one drop of blood, it varies the volume, but just the number of virus particles that are in one drop of blood is so high, so much higher than HIV and hepatitis C. That is why we see in like dialysis facilities, we typically will see an uptick of hepatitis B compared to hepatitis C or HIV. So how do you prevent bloodborne pathogens? The biggest prevention is education. You talk to people about the risks that are associated with their daily task. Wearing your PPE, making sure that you are aware of the patient that you're seeing at that time, know what their status is. So, not that you would treat them any differently, but you want to make sure that you take all of the normal precautions and any additional precautions if they're needed. Encourage your staff to be mindful and cautious, especially when they're using sharps, any type of needles. You never want to go and recap a syringe or a needle if you've drawn blood. You just want to drop it into the syringe container. You also want to encourage and enforce immunizations. Currently, there are no immunizations for hepatitis C or HIV, but there's a vaccination for hepatitis B. Most people receive their first vaccine in the hospital when they're born, and then again as a kid. If you don't know your status, you can get that checked, but that is very important to decrease the rate of hepatitis B. So prescription, if a person has been exposed to one of the three bloodborne pathogens, there is the post-exposure prophylactics that you can do. So treatment should be given within the first 72 hours to decrease the rate of seroconversion. Uh, excuse me, there is no PEP for hepatitis C, but there is for hepatitis B and HIV. In addition to that PEP in the first 72 hours, it is recommended that after exposure, a person does receive ongoing testing for up to 6 months. It should be like every 30 days, just to make sure that the person doesn't seroconvert. And there is PrEP that is there available for for HIV, which is one pill a day that a person can take. They can take every day pill and it will decrease their rate of contracting HIV. If it is taken as it should be, it can decrease between 86 to 95%, just depending on the risk. It is a little lower for IV drug users and as well as for MSM, who is men who sleep with men. But for typical vaginal sex, the rate for prevention is really high and it has a really positive result as long as the person follows that medication treatment every day. So hepatitis C currently is the only curable chronic disease. In the past, the medication for hepatitis C has been very brutal, required ongoing blood tests just to monitor the kidney functions, just to see how they're okay with how they're dealing with the medication. But technology has evolved and now the medication treatments are less severe, and as long as it's taken 12 to 24 weeks, sometimes longer, just depending on the strain of hepatitis C, it can be cured. Again, there is no cure for hepatitis B. However, there is a vaccine to prevent it, which is great. It's better to prevent than to try to treat later on. So here are a few fun facts. So HCV, which is hepatitis C, can live in a syringe for up to 63 days outside of the body. Originally, it was thought that hepatitis C was only able to live outside of the body and in the environment for up to 4 days. And recent studies have shown that this is inaccurate. And now we take those extra precautions just to be mindful that it can live on surfaces, temperature dependent, a bit more warmer, like room temperature. It is much better for them to live. HIV can live in a syringe for up to 4 weeks. Again, temperature dependent. And HCV, hepatitis C transmission occurs 10 times more often than HIV transmission from accidental needle sticks in healthcare providers. So again, it is important that you remain vigilant. You have those, you're being very mindful and cautious when you are dealing with syringes and needles to make sure that you are using proper syringe safety. And we will touch a little bit more on that shortly. So PPE, personal protective equipment. I know that right now everyone is very aware of this with the current outbreak and the importance of it. But it's a little different with, with bloodborne pathogens, as they can splash you, they can, get into the eyes, especially if you're dealing with a patient. Although it's rare tuberculosis, when they cough, you do tend to have that blood sputum. So, wearing your gloves, gowns, face protection, if you come in contact with blood or infectious materials while you're seeing a patient. You also want to know that you're not wearing the same PPE for patients. Change your gloves. If you are doing a contact, so when you're first coming into the room, you should be washing your hands or sanitizing before you put on gloves. And then as well as when you take them off, again, you should be doing the same thing. You should be removing the gloves properly, pulling from the bottom to avoid contaminating your hands. Changing the gloves during patient care. Before you exit the room, you should always remove your gloves. Never wear those gloves outside of a room if you've already seen a patient. And if you've come in contact with your surrounding areas, I know a lot of times we have moved to using laptops or tablets. So if you're using that and you're putting on gloves, if you have gloves and then you are seeing patients, you need to make sure you remove those gloves and sanitize your hands because you're taking those tablets and computers into other patient rooms. So you need to make sure you change your gloves when you're doing that. Do not wear the same pair of gloves for patients. When I was working as a epidemiologist in Arizona, we had a dentist who was working on a patient in his mouth that was with a known HIV positive status. He was called for a consultation in another room for another patient. He got up, he left wearing the same gloves, and he went and he did a consultation with the second patient, same gloves, which we highly discourage. You want to make sure you take those gloves off and sanitize before you leave the room, and then put on new gloves before you before you see another patient, which he did not do. And he did that with 3 patients actually with the same gloves. And luckily the dental hygienist was watching this. She was horrified, and she actually did report him to Division of Licensing into the health department, which is how we found out, and then it was investigating. And as recommended before, we had to notify these patients that they had potentially been exposed to HIV, and then we had to recommend them to be tested for 6 months to make sure that they don't seroconvert. And again, discard any PPE before leaving a patient's room or area. If you notice that your gown or any type of protection that you're wearing becomes contaminated, it needs to be removed and it needs to be discarded. So here are some glove do's and don'ts. Again, as you see, we cannot stress, do not wear the same pair of gloves for the care of more than one patient. It increases the chances of spreading bloodborne pathogens. And I know there was a shortage of PPE, but we do not recommend washing gloves for the purpose of reusing them. Once you use the glove, washing them does not render them sterile or safe to use again. Hand hygiene must be performed before and after, immediately before before putting them on and taking them off. Gloves should be replaced if they're torn or punctured. And a lot of times we do see phlebotomists or nurses that are drawing blood. They will often um, put on just the little one part of the glove to, touch the vein and things like that. We do not recommend that. It is a full glove. Gloving one finger is not recommended and is highly frowned upon. And it also leads to cross-contamination and infection in not just the patient, but in the provider as well. So earlier we did mention preventable diseases, and again, there's only the hepatitis B vaccine currently that most people receive as a kid. Most people are vaccinated as a child per CDC recommendations, and it is the first vaccine that you received as a baby. If you don't know your immunization status, you can have your blood titers checked for the presence of antibodies. And this is recommended, especially if you're seeing patients, to make sure that you are protected. Antigens are present when a person has been exposed to a particular virus or bacteria, which is in the blood titers. They can determine that. And immunity can be passive or active. So that's dependent on if it's been exposed versus a vaccine. For adults, healthcare providers can often receive their vaccines at their new employer, at their private doctors, community health clinics, or federal funded health centers also do provide vaccinations. The local health department, and now more and more we're seeing these pharmacies such as Walgreens, CVS, and Little Clinic that do offer vaccines that are covered by your insurance, and we recommend those. So now we'll go ahead and move into syringe safety, which is very important. And we'll talk about what syringe safety is and the role of it. These are basically measures that are taken to perform injections in a safe manner to protect not just the patient, but the provider as well. It is important because injection medication is commonly used in healthcare settings for prevention of disease, for diagnosis, such as drawing, and then treatment medications are often given in the form of a shot. So syringe safety includes drug diversion, single-use syringe, injections, lancets, and glucose monitors, which are often seen as a source of infection for bloodborne pathogens. So safe injections is, again, intended to prevent transmission of infectious disease between one patient and another, or between patient, dental, or healthcare provider during the preparation and injection of medications. So it's not just limited, again, to healthcare providers or doctors. This also extends to dentists who are also performing medication treatments and are doing injections for like numbing the patient. It's really important. A safe injection does not harm the recipient. It doesn't expose them or the provider to avoidable risk, and it doesn't result in waste that is dangerous for the community. So if you're using syringe and needles, it's important to use those biohazardous containers to properly throw away or get rid of those needles and syringes to make sure that they're not in the community, or that they're people don't have access to them. Unsafe injection practices put patients and healthcare personnel at risk of disease transmission, including bacterial infections. This includes MRSA or bloodborne pathogens that we've talked about, HIV, hepatitis C, and hepatitis B. Some of these safe injection practices, again, one syringe, one patient. Even if the needle is changed on the syringe, you still are not allowed to use it. You don't want to administer medication from a single-use, single-dose vial. If it's only a single dose vial, it should only be used for that one patient. Use a clean needle, and that's it. Not for multiple patients. It does not have the preservatives in there to prevent bacteria growth, mold from growing inside that vial. So multi-dose vials, although they do have the additional preservatives and chemicals in there to inhibit growth of bacteria, it should still be only used if you are able to use it for one patient. Keep it, just that one patient if you're able to, and then keep it out of the immediate area, the treatment area of a patient. So it is recommended you have a clean area versus a dirty for pulling up, pulling up the syringe to use them to pull the medication, and make sure that you are doing that in a sterile environment where the vial has been cleaned. And again, a clean, unused sterile syringe should be used as well. So some of the safe injection practices that are important: ASEP technique when preparing and administering medications. We are cleaning our hands before we put on gloves. We're making sure that we're wiping that vial with our alcohol wipes and cleaning it, as well as doing the same, cleaning the area for the patient that you will be utilizing, that you will be using to inject the medication or doing an IV. Any germs that enter the medication vial or syringe can cause serious infection. That's why it's very important to not use single dose vials for more than once. Again, they don't have the preservatives in there to inhibit the growth of germs in there. Germs can also be introduced at the time of injection if the port is not cleaned, if that multi-dose is not cleaned properly, if you're using unsterile or unclean previously used syringes to pull medication, you're entering that whatever is in that syringe into that vial. Hand hygiene and cleansing the access port before injecting into it. So if you have, say, if you have a cancer patient that has a port, making sure that you clean that port each and every time before you access it. Making sure that you wash your hands so that you're not contaminating any of the tools that you're using. And then single use needles, syringes, single dose vials, and IV bags. We do not want to utilize those things more than once. It's one and done, one syringe, one patient. Again, we're not reusing syringes to ensure medication vials or doses. We're disposing of syringe properly, and needles at the point of use in sharp containers that are closable, puncture resistant, and leak proof. Again, when I was working as the HAI epidemiologist, we had a new nurse that was working in a federal prison. And she was towards the end of her shift. She was working with the diabetic patients. It was testing their blood sugars and providing them with their insulin medication. She ran out of lancets. So instead of taking the time to lock everything up, go get some more, she started to use the syringe to prick the finger. She would wipe it off with alcohol, and then she would inject it into the vial to pull the syringe. And she did this multiple times. Now, no, she didn't reuse the syringe with multiple patients, but she used the same syringe that she was pricking the finger with to pull the insulin. And like, again, she did this with multiple prisoners, and it got to the point where one of the prisoners noticed what she was doing, and they're like, wait, I'm not doing this. I don't agree with this. And he actually reported her, which is he found out. So again, we had to notify all of these patients that they have been potentially exposed to HIV, hepatitis C, and hepatitis B. We had to develop a line list of all of these patients, and we had to check their status prior to know if they were already HIV, hepatitis C, or hepatitis B positive. And then we had to implement a testing strategy for the next 6 months to monitor them to see if they seroconverted, and then, protect them and put measures in place, one, so this doesn't happen again, and then to protect the patients. I will say that this particular nurse is no longer, this did cause her to lose her license. So it is very important to adhere to proper use of syringe safety, because, this is, it's very important. And it can, cause you to lose the license that you worked so hard for, and then it can potentially expose lots of patients to unnecessary diseases. So again, glucose monitors, those are single use often single use, and should be given to one patient. Whenever possible, one individual monitor for each patient. If it must be shared, it must be according to manufacturer guidelines. It should be cleaned after each use according to the manufacturer guidelines. Some can say with a chlorine, a bleach solution, or may just require alcohol wipes, and things like that. So if the manufacturer doesn't specify how it should clean, then that does mean it should not be shared and should be assigned to just one patient. So for those reusable finger stick devices, they should never be used for more than one patient. The lancet, the platforms, and the end cap should be disposed of after each use. Again, these have been associated with hepatitis B outbreaks from improper cleaning practices. If the manufacturer does not provide you a specific cleaning guidelines on how to clean this instrument, then that means it is not allowed to be used with more than one patient. Again, for insulin administration, we just kind of talked about that, how we did have that nurse that utilized that syringe, which we highly discourage. We do not recommend to, provide insulin as well as check the blood. But insulin pens, they are single-use devices. It has an insulin reservoir that contains several doses to be self-administered. At no time should these be shared, and the needle should be changed, not should be, must be changed before each use. They should be assigned to each person. If you're in a facility in the hospital, that person should have that equipment assigned to them. If this is in the clinic, or even if we're sending patients home with their insulin pens, we should make sure that you're educating them that these are all single use. Do not share them, and they should only be used by the patient. So insulin vials, multi-dose insulin vials should be dedicated to a single person if possible. And that is just to decrease the rate of them being exposed to the syringe being exposed to multiple syringes from patients, even though we use new syringes. And even though these vials do contain the preservatives to inhibit the growth of bacteria, it's not perfect. If it's used by multiple patients, it should be kept away in a certain area, which again, you should have a dedicated clean space, and then your dirty space. From clean is where you are going to be preparing medication, and it should be away from the patient care environment. The patient care environment typically is more contaminated because even though we do go through and clean those high contact areas and clean in between each patient, it still has a higher risk of being contaminated. Insulin vials should always be entered with a new needle and new syringe. And it should be, again, practicing those aseptic techniques. And needles and syringes should never be used to administer insulin to more than one person and should be disposed of immediately. And again, those approved sharp containers. I have provided here some references that was utilized to put together this presentation, as well as that you can use in your practice if you need additional information about those guidelines for preventing infectious agents in healthcare settings, as well as the latest recommendations from the Center of Disease Control. So, thank you. If any questions, I'll pass it to my teammate, Brian, and thank you.
Thank you, Tori, for a great presentation. We do have one question in the chat box, or in the question and answer box. What are some of the things that we can do in the police department to protect our staff?
Thank you. Some of the things you can do in the police department, of course, with COVID-19, you do want to continue wearing your gloves, hand sanitizer, keeping your hand sanitizer available. So I know you do come in contact with I'm not going to say patients, but people in the community. So educate your police staff on the potential risk of those bloodborne pathogens. Let them know if they do receive a stick or a bite mark or a scratch, to notify their higher up to let them know so that they can obtain that PPE, not PPE, that PEP, post-exposure prophylactics within the 72 hours, which will include obtaining a test, hepatitis C, B, or HIV test, and then getting on the recommended medication to prevent that seroconversion. You want to provide them with gloves that they can keep with them if they potentially do come in contact with a patient of unknown status, and then encourage their vaccinations, their hepatitis C, making sure that they are up to date on them. And just being mindful of the potential exposures that they may encounter in their daily jobs, saliva, trying to maintain that distance from them and avoid potential contact with bloodborne pathogens. Be mindful if they needle sticks and sharps, so things like that. Just being very vigilant and mindful of them. And then anytime, again, they receive those scratches or anything, making sure that they do the necessary precautions to get tested.
We have another question. Any recommendations on developing policies and procedures or templates?
I'm sorry, can you say that one more time, Brian? You broke up.
Sorry. Any recommendations on developing policies and procedures or templates?
Yes. So that's a loaded question. We do have here at USET, we have guidelines that we can work with you on a one-on-one basis. It's not a one and done, and it does depend on the setting, the type of care that you're providing. So for like, if you're doing dialysis treatments or if you're just doing primary care, or it depends on the practice. So if you would like additional support or information on that, my contact information is here. Please reach out to me and I can work with you one-on-one to provide you that tailored support for developing those templates, just depending on what your need is. So, thank you.